It takes many months for folks to recover their functionality, and some men don't. I'm James Eastham, Chief of Urology and a prostate cancer surgeon at Memorial Sloan Kettering Cancer Center in New York. Prostate cancer is actually quite common. About 1 in 7 men will be diagnosed with prostate cancer. Not all of those men will require treatment. Treatment is guided by the risk of the cancer. For the majority of men with intermediate or high-risk cancers, we do recommend treatment, and one of those treatment options is surgery or radical prostatectomy. Incontinence is actually quite common after surgery. I tell all of my patients, you are going to experience incontinence. We tend to measure outcomes a year or 2 years after surgery, and that's a long time to experience a negative event. So if we can shorten that, that's beneficial to the patient. I think patient education prior to surgery is incredibly important. Uh, Most patients are resilient. They can go through things if they have realistic expectations. If you tell patients, oh, we're going to take your prostate out and everything's going to be great, you're likely to have a dissatisfied patient because there is a recovery time. So there's the physical recovery time of just going through an operation. Incisions, even though it's minimally invasive, it's still an invasive operation. I think coping to a large degree is about having realistic expectations, having set expectations. If you tell the man, oh, you're going to be fine, incontinence doesn't happen very much these days, you'll do great, most of your patients are going to be unhappy. If, however, you have prepared them, they still may not be happy that they're leaking, but at least they understand they're under the umbrella of what's considered normal. Incontinence and having to wear a pad or even a diaper for incontinence, it weighs on people's minds. They may restrict their social circle. So there are some men that we call socially continent. Basically, if they're out and about doing their normal activities, as long as it doesn't involve a lot of heavy lifting or that, they're dry. But if they go to the gym and they start working out, they may leak. So they have to adjust to that. And letting them know that that change doesn't have to be bad. It can be a very good quality of life. It just may be a very different, very good quality of life. So again, setting expectations. It's all about that. Humans are resilient. They can adapt to a lot of things. So a diagnosis of prostate cancer is, a life-changing event. It doesn't have to be a life-devastating event. There are a number of strategies we can use both in the treatment arena and in the quality of life arena to support men on their journey while they go through management of their disease.